In my experience, for example, let's say you have somebody with a bacterial infection. Homeopathy, if done properly, is faster than allopathic medicine. Allopathic medicine with bacterial infection is the use of antibiotics, essentially. It's going to take 24 to 48 hours to develop enough levels in the body to be effective against those bacteria. We see results with homeopathy in an acute bacterial infection within 12 hours. So homeopathy is faster there. Now, let's look at chronic disease where you're saying that it's longer, but it has a cure. If you have a condition, for example, let's take a condition like multiple sclerosis, for which there are no conventional curative therapies. So if you have MS and you go to your neurologist, they will give you medicines which will slow the progression if they're successful. Of course, there may be every one of them has significant side effects, but let's say you don't have them. The best you can hope for is no side effects and a significant slowing as a disease continues to progress, if that's going to be the case in your case. With homeopathic treatment, in my experience with MS, we put people into remission and they stay in remission. They don't progress at all. End of story. Is that a cure? Well, I don't know if we can say it's a cure or not, but they sure keep coming back. We have one patient, for example, that Dr. Grice and I were working with, who I've been treating for almost 10 years now, who comes in about once a year. She gets a dose of homeopathic phosphorus. I don't know why she comes in. She could take it herself, but she does. She comes in and check with her. And she's on thyroid medicine, so I have to write her a prescription for her thyroid medicine. And we give her a dose of phosphorus, and she hasn't progressed in all that time. And she was when I started to see her. So that's the typical kind of thing. Well, how long is that compared to the other option doesn't exist? Well, yeah, it takes a long time, but there is no cure in the alternative. The alternative of the conventional doesn't have a cure for a lot of these things. Rheumatoid arthritis, another fantastic example. You know, the drugs that we use for rheumatoid arthritis on the conventional side are very dangerous. These immune suppressive drugs here in the States we call Enbrel and so on. Things that even milder things, which are hardly mild, like methotrexate, which suppress the immune system so that it can't have this autoimmune effect. Autoimmune meaning attack the body's own tissues with our own antibodies. Well, when you reduce the immune system, you reduce the immune system for everything. So the television's ads say, take this drug, and we have a lot of advertising in the U.S., for drugs. Take this drug, but be sure to tell your patient if you've been anywhere near anybody who might have tuberculosis or might have this infection, and you want to be careful about this infection, and you could have this. That's not a cure. That's not a cure. So if I cure somebody with rheumatoid arthritis, and it took 2 years, that's a lot faster than somebody who can't cure at all. Now, we use that word. For some of these things, we don't have the scientific data to assure you that it was the homeopathy that cured the patient and this and that. So I don't want to be inappropriate and make claims that aren't substantiated. And the only way you know for sure that anything works and isn't a placebo response is to have double-blind, random controlled trials, of which we have plenty of, but an N of one, a patient, just one patient at a time. I can't guarantee you that it was homeopathy that cured them, but I can tell you that the patient doesn't care. They're very happy to not have their joint pains or the systemic problems if they have lupus or something like that. Well, we were talking earlier about ADD and ADHD, and this is an area we have very good research. I was just at a conference where a Swiss doctor, pediatrician, Heiner Frey, came over to talk about his research with kids with ADD and ADHD, with very positive results. When they did an interesting trial where they looked at, of course they did the randomized control trial, but they did another one, an observation trial, which was in some ways more interesting, where they literally compared who needed to have a stimulant drug like Ritalin in that case, and who could benefit just with homeopathy. So it took all the kids, and the way they did the trial was they put them all on homeopathic treatment. It was individualized homeopathic treatment. And they went along, and then at 3 months and 6 months and so on, they did 3 measures. They did their own measure, which are standard in the research world for ADD and ADHD. They did the parents' report, and they did the school teacher's report. And based on that, at a certain point, whether it's 6 months or 8 months or however it worked with the individual, they decided this child is not doing well enough on homeopathy and needs to go to stimulant medicine. Or this child is doing fine, we're going to just continue, and the parents made that decision as well as the researchers, we're just going to continue with homeopathy. 75% of the kids stayed on the homeopathy arm. Only 25% of the kids went to the stimulant arm. Well, that's a lot of kids who can avoid what are serious and dangerous drugs. I mean, we're giving children for ADHD drugs that if an adult out on the street here bought from their buddy, they'd end them up in jail, because that's essentially methamphetamine. It's a different form. It's not methamphetamine, but it's a kind of amphetamine. We're giving this to little kids, and we're expecting them to take it for the rest of their lives. And certainly it helps some of them. We can't paint with the black and white brush. It certainly helps some of them, but we can help quite a bit with homeopathy without the side effects, without the risk of addiction, without all the problems that we get with those drugs. So that's another good example, I think. Some of the huge discussions that are going on in terms of saving money, because you know that this is a big political issue in the United States right now. One of the big issues is what's called hospital readmissions. Somebody goes in the hospital, they have surgery, and then 3 weeks later they have to go back in. Okay? And the hospitals are spending a lot of money now because the way the new Affordable Care Act works, they're going to start dinging the hospitals financially for this extra cost. Okay? If we did homeopathic treatment of those patients as they left the hospital and even while they were in the hospital, I would be absolutely certain that we would cut that readmission rate, because we would be taking care of those patients inexpensively and effectively, enormously, save a ton of money. I can't imagine a health insurance company wouldn't be interested in that. And it'd be an easy study to fund.